Good afternoon and welcome to today's session of Business as Usual. I'm Audrey Russo, President and CEO of the Pittsburgh Technology Council, and I'm joined today with Jonathan Kirsting. He's the Vice President of Visibility and also my co-host on Many Things Media. So just a few things about today's call. First of all, we have to give shout outs, deep appreciation to both Huntington Bank and AT&T. They've been with us right from the beginning. Huntington Bank has believed in us on so many different things that we've done in terms of our media channels. But if you don't know them, they are actually the #1 SBA lender here in Southwestern Pennsylvania. And their leadership is very active in our community. So thank you so much for Huntington. Also want to give a shout out to AT&T for their sponsorship and support, and also everything that they do for their customers and communities in response to COVID-19. And we previously highlighted some of their volunteerism and their support of Allies for Children, 412 Food Rescue, as well as the Greater Pittsburgh Community Food Bank. So as a programming note, this week we also have a great lineup in addition to today hosting Christopher Johnson of TeleTracking. Tomorrow we have State Representative Carl Metzger, who represents parts of Bedford and Somerset counties. And as a cattle farmer himself, Representative will talk about the challenging issues that are facing Pennsylvania's food supply, including efforts to help prevent milk dumping. On Wednesday, we go live with Dr. Chris Howard, president of Robert Morris University. On Thursday, we're hosting Mikhail Tashom. He's the vice president and senior regional officer for the Federal Reserve Bank, who's going to discuss the Fed's new Main Street lending program for small businesses that was announced just last week. And we wrap up the week with Farnham Jahanian. He's president of Carnegie Mellon University. So a little bit about the tech on today's call. And we have muted everyone's microphones. We've done that to make sure that there's no unnecessary noise in the background that many of us have. And you can also note that we have a chat. You look at the bottom of the screen. That chat will actually allow you to ask some questions. Hopefully we'll get to all of them. If not, we'll make sure that our guest gets those questions and we figure out a way to answer them back to you on our site. We are recording today's event, so for those who want to share that later, the link will be up this afternoon. We also, one last thing, we want to make sure that this isn't an opportunity for you to sell, not to do any of your own advertising. This is really meant for just an inclusive conversation with our guest, who today is Christopher Johnson. So with that note, I would like to just bring on Chris Johnson. He's president of TeleTracking. And if you don't know anything about TeleTracking, really keep your seatbelts on, because we are going to do a quick dive, as much as we can do, to understand the business that they're in right here from Pittsburgh, as well as the impact that they're having all around the world in terms of healthcare. So Chris, thank you for being with us today. Really appreciate it. And I know TeleTracking has been incredibly active throughout this pandemic. So tell everyone who's listening, what is TeleTracking and why so relevant and important, not just now, but also in the future?
Great. Well, thank you, Audrey, for having me, first of all. So it's Chris Johnson, president of TeleTracking. And just to give a brief synopsis of Tele, which is what we call it. Tele is a healthcare operations company founded in 1991 right here in Pittsburgh. And we pioneered the field and continued to grow that business in what is now 29 years. And it started with the focus on simple visibility in our healthcare system around beds, utilization, occupancy, and patient flow. And it's continued to grow over this time into something quite larger. So in 1991, Michael Zamias, the current owner of TeleTracking, invested in a business that was basically what we called a bedboard that has been mimicked now broadly, a way to graphically see bed capacity and utilization. You know, at that time, and unfortunately today, still in some hospitals, state of the art is whiteboards and phone calls when it comes to managing patient flow. And what we saw was an industry that was blind, partially due to the lack of technology and partially due to the reimbursement model. A system that did not understand their cost basis, and we saw that on a trajectory that healthcare would be a significant portion of the GDP, and it's now on track to hit approximately 20%, which is measured in trillions of dollars. And so in healthcare, nearly half the cost of healthcare is in labor. And our estimates, and fairly well documented by others in the industry, is that labor is about 20% efficient without a system like TeleTracking, which means that 80% of every labor dollar is either or underutilized from a productivity standpoint. And we believe that is unsustainable. So TeleTracking does three things: technology, advisory services, and an analytics platform to help manage healthcare operations. We work with about 1,000 hospitals, a little over 1,000 hospitals in the US, UK, and Canada, and have established a set of proven best practices supported by our technology and analytics that drive behavior and drive right behavior in healthcare. In 2009, TeleTracking introduced the concept of the transfer center, which ultimately involved in what we call the Care Traffic Control Center. And this is a centralized mission control, similar to what you'd see at NASA or a nuclear power plant, or even air traffic control is where we got the play on name. Managing the activity across and throughout the health system, inside and outside the acute care space or the hospital. And this has been our focus over the last several years. So TeleTracking is here in Pittsburgh, headquartered in Pittsburgh. We have remote offices in Nashville, London, Minneapolis, and Raleigh. We're just under 400 technology operators and healthcare professionals dedicated to the mission that no patient should ever wait for the care that they need.
So what immediately changed for TeleTracking since the COVID pandemic?
So that's a great question. And I think everyone on the phone and on this video was hit hard and fast by this, and COVID has had a dramatic impact on TeleTracking. We're a healthcare solutions company, and this crisis has illuminated the need for what we do more than ever. Like most companies, we had to take a serious look at our business early on as this crisis came into view. We knew that our large deals and some cases would slow. Healthcare systems were simply fully engaged in managing and preparing for the crisis, and stopped pretty much all non-COVID based activities. We modeled those delays and the delays in our implementations and things of that nature as we prepared and started to engage with our clients. And fortunately, and I don't know if I'd say a pleasant surprise, but in a positive light, TeleTracking was able to, one, be ready for this crisis. We have a strong balance sheet and a business model that was built for endurance. And the reality of what we saw in the market is that it exceeded our expectations. While some of our deals were delayed, our existing customers had needs that only TeleTracking could meet. Hospitals across the US and UK needed to expand capacity, reconfigure their operations, and needed better analytics in order to prepare and manage through the crisis. And TeleTracking immediately put some things into motion. We put in a rapid deployment solution that allowed us to create visibility and operational insight into new facilities over a 24 to 48 hour period. We call that rapid deployment. We also helped them connect to FEMA-based hospitals. Some of the command centers that I mentioned became hubs in places like St. Louis. And so FEMA-based hospitals became extensions off of hospitals where we had deployed. And we had also deployed our analytics solution in order to provide better insight and visibility and analytics into the management of the crisis. And 100% of our customers who use our analytics platform have adopted that and utilized that throughout the crisis. So as we move forward, the good news is that even the new activity that we had underway, we built significant momentum off of our existing customer base, but we've also been able to bring additional new customers on. Several systems that were hit incredibly hard by the COVID pandemic made the decision to move forward, even though they had limited on their side, because they knew that they had to be ready for the next wave in front of it. And so we've continued to move forward there. And then lastly, TeleTracking was asked by the US Department of Health and Human Services to provide expertise and visibility into our national healthcare infrastructure. And we are collecting data on HHS's behalf for what is now thousands of hospitals. Some more automated than others, i.e. those who are using TeleTracking's platform have much more of this data available in real time. But we're gathering it from upwards of 6,000 hospitals over the last couple of weeks. And our solution has been well received and been modified beyond just providing visibility to help with the facilitation of CARES reimbursement into particularly the hotspots in the US. And as I said, over the last couple of weeks, over about 3 days, we collected data on about 6,000 hospitals to provide data into the formulary that was used for those reimbursements. And so we're very proud of the work that we're doing now with our existing clients, with new clients, and with HHS. And we believe that is very in line with our mission to ensure that no patient ever waits for the care that they need.
So we have 2 questions, Jonathan, out there. If I just want to jump in, I think there are 2 questions for Chris.
Absolutely. Yeah, these are all pretty good basic ones to get our crowd a little more up to date about what Tele is all up to these days. I guess first and foremost, is teletracking deployed in nursing facilities? And also, how do patients most, I guess, directly benefit from your services?
Okay, so 2-part question. In nursing facilities, we are in SNFs, skilled nursing facilities, in some parts of the country, and it has been an extension off of what we do in the acute care space. It is relatively newer than what we've done for 29 years, really over the last 3 that we've begun there. Obviously, long-term care, skilled nursing facilities, and other post-acute facilities have become highlighted during this crisis, and we fully expect that portion of our business to extend fairly significantly. So as it relates to the second question, how does this directly impact patients? And I would summarize it this way. TeleTracking gives back to caregivers the most valuable resource on the planet, which is time. Time that is no longer spent looking for things, time that is no longer spent duplicating efforts or doing other non-productive activities. We return time to caregivers who therefore then engage with their patients more. And so that is the greatest benefit that I would say happens with the teletracking solution.
So also, how does Tele actually integrate with like electronic medical records and so forth?
So teletracking integrates with every EMR that's out there through necessity. With 1,000+ customers, we had to integrate with every EMR, but generally not just the EMRs, but upwards of 80 different systems throughout the hospital. Now, teletracking differentiates itself significantly from the EMR. EMR is a logging system. Teletracking is a logistics system. And so while the EMR is highly specialized and I think well-suited, still evolving and needs to, but well-suited for documentation purposes, it is not well-suited for logistics. So teletracking works in conjunction with that and helps things move.
Okay, and then we have one more question.
Yeah, absolutely.
Jonathan, do you see that?
I do. This is a really great one. So have any of the hospitals that you support, have they been overwhelmed by COVID-19 patients? Are there any factors that you're aware of that could have reduced the overwhelming effects of that?
Yeah, the largest and heaviest impact that we've seen is our hospital systems in New York. Obviously, it is the epicenter of everything COVID. About 395 hospitals across the U.S. represent about 72% of all COVID patients. Heavy concentration, obviously, in the hotspots. New York being one of the largest. What could we have done better? Was that the question there, Jonathan? Okay.
Yeah, actually, what could the hospitals potentially have done better?
Well, I think from my perspective, we were caught in large part as a nation flat-footed. As far as understanding our capacity and utilization, the early phone calls that we started receiving, obviously from teletracking customers, very quickly in your command center, you can see instantaneously the beds that you have available, ICU versus med-surg for different kinds. What is the expected discharge date? So when can those beds be emptied? What is the utilization of ICU beds and how quickly can we move people forward? And so teletracking customers were able to answer a lot of those questions very, very quickly. For many people, that was not as easy as they would have liked. And so they had to take kind of large, instead of I guess use a little bit of a medical, instead of a scalpel, they had to use a bit of a broadsword. Let's start moving things in large chunks and large portions in order to make that happen. Second thing that I saw in New York, for instance, it was legislated that every hospital had to show a plan and increase their capacity by 50%. with the target of 100%.
Mhm.
And so this meant moving into community college dorms, and move into SUNY New York, into the Javits Center, into others. And so those who were prepared to extend by having an operating platform like TeleTracking, within a 24-hour period, were able to consume that space, identify it as clinical space, identify how they would slice that up, how they would allocate patients and move patients in and out of those facilities. So without an operating platform, I think in large part it was, and trust me, I've talked with a lot of people who did not have TeleTracking that wish they did, but they also did amazing work. There are amazing people in healthcare that in some cases were rubbing two sticks together, but they were able to create fire through pure passion and earnestness. And I'm very impressed with them. But those are the same people we're now talking about that in preparation for the next one, let's put technology and 29 years of experience into service for you.
And so there's just another question. I want to get into a couple of other things. Do you see COVID changing? This is from Anita Nikon. Do you see COVID-19 changing TeleTracking system going forward itself?
And changing our system, actually, I think to some degree, it is accelerating, and we mentioned this before. So I would say TeleTracking system is incredibly well suited for the management of this. One of the reasons that we were called by HHS is that we had already put in a proposal and been asked to propose on a disaster preparedness, disaster readiness solution for some of our southern states. Florida in particular, as it relates to hurricanes. Obviously, the pandemic hit in that times 100, right, across the entire United States. So our system is already well suited for this. What I would say is that it has accelerated our focus on the non-acute care settings, long-term care, skilled nursing facilities, into the doc offices and home. We have anchors into those places today. But we're much farther along from an acute care space, just given our history. But I do see it. I do see COVID accelerating that quite a bit.
So you're now working with not just HHS to provide insight into the entire U.S. healthcare infrastructure, and there's a national security issue that I would think is tied to this. Is that correct?
I have said for a while that I think it is that I do believe it is a national security issue, and a couple of reasons that I see that. One, and this one is a little bit nicer than the second one. One, at 20% of the GDP, healthcare is getting to a price point and a cost point in the U.S. that is unsustainable. It is creating economic pressures on employers. It is creating economic pressures on our safety net system. It is creating incredible economic pressures on individuals. It is unsustainable. And so that's one. The second one, which is a little bit more nefarious, but is a real problem. And I'm not a conspiracy theory guy. And let's give benefit of the doubt that COVID, as in its current form, was either through natural causes or through an accident. Mm-hmm. But there are bad actors. There are bad actors in the world who are seeing that we've been able to, in a very short order, shut down not just the national economy of the United States, but an $80 trillion global economy with the release of this virus. And there are people that are very interested, and I believe that you will see in the future increased interest by the Department of Defense, the Veterans Administration, and our intelligence community on understanding and having sensitivity analysis available to the pressures on our healthcare infrastructure globally.
So you're now getting pull and interest from countries outside of the United States. And of course, people are interested in operational excellence. That goes, without saying, but why now and what's different and why TeleTracking?
So we are getting interest from around the world. We're actively engaged. I've already said that we're in the UK as our second largest market today. Germany and the Middle East are also major areas of focus for us and have been a pull in a couple of different ways. Excuse me. Oh, gee, I'm supposed to do it in my elbow.
Good
Sorry,
work.
I got busted on camera. Just like Biden. All right, Germany and the Middle East. And so these engagements actually started prior to the crisis, but it has been magnified in need. Regardless of your payer system in the UK and in Germany have some different payer systems, the need to help more patients within the existing or lower cost basis is a national priority for many countries. And while the US spends a multiple than any other country per capita on healthcare spend, other countries are still feeling the pain. Germany, for instance, and this is what drove our activity in Germany, is approaching 10% of the GDP in healthcare spend. They are mandating that that stays in single digits. And the only way to achieve that is to become more efficient. And so we are working with them in teletracking. Why teletracking? And hopefully this doesn't sound egotistical. We are the leader in this space. We have been focused on this for 29 years as a singular focus, not as an add-on, not as a pop-up during a COVID crisis, but in preparation for what is happening today. And so teletracking is in the pole position globally, I believe, as far as operational efficiency in healthcare.
So, but who are the competitors in this space? And, you know, so many companies exist in health IT today. So what's your, you know, you talked about, I think we heard some of the differentiators and some of the core competencies in your years of expertise, but, you know, health IT is proliferating today, and if not more during these times.
Proliferating, profiteering, yeah, I mean, it depends. I've seen both. I've seen both happening. Actually, the number one competitor is probably not one that you've heard of before. You've heard of the number two competitor to teletracking. The number one competitor to teletracking is somebody that I call Do Nothing. And it may sound a little trite, but it's true. Even with downward pressure and reimbursements, operational efficiency has not been a top 3 strategic priority for many systems. For some, it has. And those are the ones that teletracking is most successful and engaging. And this crisis has ended that. I believe that Do Nothing is no longer a competitor in this space, and that no rational person can look at the situation that we have gone through and are working our way out of and not see the need for operational efficiency. So I'd say the second place competitor, Audrey, is the electronic medical record. And somebody asked the question on this a little earlier. And these are companies that you've heard of: Epic, Cerner, Meditech, and others. And following the massive grant programs that entrench these systems into our hospitals, they have been trying to extend their reach outside of the medical record. And quite frankly, given their monopoly-like position, they have leverage. And they have had leverage for a number of years, but we win as many as we've lost, if not more, when we go head to head in this space with somebody who is looking to make impact. Looking forward-looking health systems understand that logging and logistics are different things. And trying to get your documentation system to be your logistics system is asking that system to perform unnatural acts, in my opinion. And so the documentation system has a place, but we and others believe that there is a need for both. In addition, for systems that have multiple EMRs, because interoperability was one of the big promises of the electronic medical record, we work with a large number of systems that have multiple EMRs through mergers and acquisitions and things coming together. These EMRs do not work particularly well together. TeleTracking rides on top of that from an operational standpoint. We are agnostic to the electronic medical record, and we can provide operational visibility across a multi-EMR system. And so we play very well in those areas.
So, as we wind down this conversation and you get a chance to see, everything that's happening in our healthcare systems, what's your crystal ball? What do you think, for the US and Pittsburgh, and is it 2 years? What's the next 2 years? Give us some of your wisdom based on your experience.
I'll give you some of my insight. You'll have to determine later if it's wisdom or not. But I like to go back to, I think it was Bill Gates who said, people tend to overestimate what can happen in the next 2 years, but underestimate what can happen in the next 10. So, but I'll take a stab at it. I believe over the next 2 years, you'll see great healthcare systems will no longer be willing to tolerate what is today defined as business as usual as managing their healthcare infrastructure. I think government leaders will no longer tolerate having a blind system in advance of disaster, natural or otherwise. I think what you'll see, and I mentioned this before, the Departments of Health and Human Services, the VA, the DoD, and our intelligence community will demand sensitivity and visibility into the utilization of our resources and have a better, more mobilized system beyond what is today a regional system, right? FEMA is a regional system that's set up to manage a hurricane, set up to manage fires, or set up to manage certain things. In order to mobilize nationally, you have to have visibility nationally. And this will require a national operating platform capable of providing visibility and management to some level. We are still a privately run healthcare system, so the government has a separation of duties that needs to be worked through, but providing visibility and management to the over 900,000 acute beds in the country. And across the boundaries that exist today, there will have to be some transcending of those boundaries. Now, more specific to the health systems, I think the previous prediction of what every health system in the U.S. would have a operational command center like TeleTracking provides. Most studies and our own prediction was around 2025 that would happen. I believe this has accelerated it dramatically. And I would say no later than 2022, you'll see that every major health system has a air traffic control or like solution in place. And so TeleTracking is well positioned there. Now, let's bring it home real quick because we're down to a couple minutes. I would say specifically to Pittsburgh, because this is a Pittsburgh Tech Council discussion. I think Pittsburgh has, and my adopted hometown, has every ingredient that is necessary to lead in this space. We have great health systems and great health plans that are servicing our community. Technology solutions like TeleTracking and world-class universities like CMU, Pitt, and others. And therefore, I believe that Pittsburgh can be and is the ground zero for healthcare change and reform moving forward. So that is my high-level predictions. You can come back and tell me in 2 years if I'm right.
So are you hiring?
Absolutely are hiring, particularly very interested in the analytics space. Pittsburgh is a great place to recruit. TeleTracking has been continuing to build on our analytics because we have developed over 29 years the largest and most comprehensive repository of healthcare operations data available on the planet. And we need to put that more into service for this industry, this country, and quite frankly, globally.
So there's opportunities. They can go to teletracking.com and you can see what opportunities are out there.
Please do.
And how are you, Chris, taking care of yourself?
Wow, that was a curveball. I never actually talked about that. I'm being careful. I'm following the guidelines. TeleTracking is working 100% remotely. I am in the office, but I am one of 3 people working out of our office. We've gone to a completely mobile and remote workforce. I am back and forth to DC on a regular basis, so I'm following social distancing guidelines and things of that nature. And I have learned that long walks in the evening are both therapeutic and good for the brain and good for the soul. So that's what I'm doing.
Well, listen, first of all, thank you for taking the time. I know it was hard to get you scheduled. I know that you are doing a ton of work in terms of trying to move the needle forward, and you're really busy. I'm glad that you're still hiring. I'm glad that everyone that's working for you is virtual and safe. And I look forward to toasting to you at some point in the near future for the work that you've done. So I want to thank everyone and thank you, Chris. And if there's any questions that we've overlooked, I'll make sure that they'll get sent over to Chris so that we can get an answer to them. So really appreciate that. We actually have a career fair that's coming up in May 27th, and TeleTracking is actually participating in that. It's a virtual career fair. So if you want information, go to our site. I also want to thank Flexible, who actually is providing all week free interactive Zoom sessions for kids between the ages of 3 and 10 so that they can enjoy our Zooms and do some interactive stuff in a safe environment on technology. So look for that. And then join us tomorrow as we have Representative Metzger and talk about the issues in terms of milk dumping and other things as it relates to our economy. We are trying to keep ourselves current and make sure that the whole tapestry of the work that's affecting our region is being provided to you live and in real time. So thank you so much, Chris. Thank you, Jonathan, for being with us. And this is Audrey Russo. We'll see you tomorrow, same time.
Thank you.
See you guys.